Hi, I'm again Dr. Salil Kandwala from Advanced Urogynecology of Michigan. Today we'll talk about the importance of patient testimonials. Urinary incontinence and the pelvic floor conditions are very, very common. 1 in 2 women suffer from this. Significantly affects their quality of life, intimacy, and sexual function, and overall perception of life. And it can happen at any age. But women, sadly and unfortunately, wait for almost a decade before they seek help. Continue to wear pads. They get no or very much of misinformation from even their healthcare providers and from the media. And the media propagates this to be an embarrassing condition. It's Women think it's just being part of getting old. There's no option and no treatment available for these problems. And 70% of patients bothered by overactive bladder, truly bothered by this, do not even return to their specialist after one clinic visit and continue to suffer. Now, why? Why does it happen? First of all, there is no definitive workup done. Just a medication is prescribed, no specific workup done. Another medication, another day, did not work. Side effects worse than the benefits. That's not explained. What can happen with the medication? Cost prohibitive. Some new samples are given to the patient, and when the samples are over and a prescription is given, it's too expensive. Then drug interactions can happen, and then there are unrealistic expectations that are not conveyed by the doctor. Oh, it'll take care of it, you'll be good. No, I mean, it all depends upon so many factors. Doctors themselves do not understand these issues, and they do not know and they do not address these issues. And they talk about obsolete things such as bladder suspension, unmonitored Kegel exercises. I mean, just go and do Kegel. We don't even know what she's doing. And they simply do not recommend anything sometimes. Wait until it gets really bad, they may say. So even if we are at fault, we don't give the right information, then how will the poor patient know? Well, what's the fact? Fact is all these pelvic floor conditions, the urinary conditions, the vaginal conditions, the bowel conditions can be treated and can be satisfactorily improved. Pelvic floor dysfunction is a medical condition, just like any other, and there is no reason for embarrassment, and the procedures done are not cosmetic. They're like any other medically indicated procedures covered by insurance. And most of these conditions, I mean, think about this, most of these conditions can be managed in my office, right in my office. Pads never worn by my patients. My patients remain cured and satisfied with their outcomes. Even if I go to the operating room, it's usually to an outpatient surgery center. And if I go to the hospital, it's just to do a big prolapse case. But next day, she is essentially home. I could literally be sending her home the same evening. So even for large prolapse case, they could go home the same evening or the next morning and return. So most of these patients, like slings or overactive bladder procedures, go back to normal activity the next day, and results are immediate. And most of these procedures are done completely under local anesthesia or maybe a little sedation. So you know what's the most common regret of my patients? How come? How come no one, including my doctor, no one informed me about these treatment choices? If I had known, I never would have waited this long. Let's change that, one testimonial at a time. So what is a testimonial? It is you telling your own story in your words for other women to learn from and understand, and not continue to suffer in silence in the way you did until now and until we took care of you. So how is it done? Well, we have a team waiting to help you. My team members will get in touch with you and explain to you the process. It is time for women to speak up and share this knowledge, woman to woman, a patient to patient, not a doctor woman to a patient. It is a patient to a woman. You have benefit from the treatment with us. Now it's time for others to benefit from your information. So when I give a talk like now, it sounds great, people like it, but it feels a lot sterile. I'm wearing this lab coat and a sterile doctor coming from a doc. But when women who have experienced this talk about it, it hits right home. That is the power. The women share recipes or a post on Facebook, right? Why would you not share something that has changed your life and can do that for someone else too? We have staff, as I mentioned, ready to help you get your story out. Please help me in breaking the ceiling of women's pelvic health. If we all do our part, these pelvic floor conditions will no longer remain a closeted issue of embarrassment. Remember this young, fearless girl statue? And if you've ever been to New York City, right across Wall Street from this raging bull is this fearless girl. That's what we want. It is time to break the ceiling. It is time for equality of care, health care for women and men. It is time to stop labeling medical conditions as embarrassing. It is time to improve and increase awareness. And finally, it's absolutely time, it's overdue to stop wearing pads. So please help me in delivering this message to women, and that'll be a fantastic service that each one of us can do for women at large. Thank you.